In this section, we will show you some of the positive findings you can find in the musculoskeletal system examination. In this first picture, you can appreciate the bilateral knee joint swelling in a patient with oligoarticular GIA, whereas in this picture, the patient of polyarticular GIA is having involvement of multiple joints including bilateral elbow, wrist, knee, and ankle joint. Here is a picture of a small child suffering from systemic onset GIA. You can appreciate the spindling of the fingers due to the swelling of metacarpophalangeal and proximal interphalangeal joints. Here you can see the typical boutonniere deformity, also called the buttonhole deformity of both hands, along with the limitation of movement at wrist joint. Here the same deformity is more prominent in the left middle, ring and little fingers. Here you can see the swan neck deformity of the finger. In this picture, bilateral ankle joint swelling as well as the hallux valgus deformity of the big toe, whereas the flexion deformity and overlapping of the rest of the toes. Here you can see the small chin and the loss of angle of mandible due to the involvement of temporomandibular joint. This is particularly seen in the patients of seronegative polyarticular GIA. This is the typical salmon pink maculopapular rash in a patient of systemic onset GIA. This rash is more prominent on the trunk. In this picture, the rheumatoid nodules are shown on the spine as well as on the extensor surfaces of metacarpophalangeal joints. Here, starting from the left, you can see the nail pitting, oncolysis, and the different type of rashes which can be seen in the patient of psoriatic arthritis.